Hello, my name is Brittany Buchanan, and I will be discussing the condition of whooping cough, or better known as pertussis. The whooping cough, or better known as pertussis, is caused by the bacterium Bordetella pertussis, which is transmitted from infected to susceptible individuals through droplets. This is primarily through coughs or sneezes, but can also be transmitted through saliva. This can include kissing or sharing drinks. Another way pertussis can be transmitted is by skin-to-skin contact. This can be through handshakes or hugs, for example. Pertussis is highly communicable meaning highly contagious and infectious. Pertussis is inhabitant and pathogen of humans only, which means there are no animal reservoirs. Pertussis can only be passed on from human to human contact. Humans are both the carrier and receivers of the pertussis bacterium. In 1679, Sydenham, an English physician, first named pertussis, which means violent cough. The first case of pertussis, however, was not reported until 1906 by Bourdet and Gengu. Bourdet and Gengu isolated sputum of a patient with pertussis. A sputum is a mixture of saliva and mucus coughed up from the respiratory tract. This helped in aiding the medical diagnosis of pertussis. It also helped in the discovery of the pertussis vaccination. The pertussis vaccination was discovered in the 1930s, and widespread use of it was in the 1940s. I will further discuss the pertussis vaccination later in this presentation. While there are many signs of pertussis, the main symptom is coughing. According to research, the disease is often overlooked, especially in adolescents and adults, and is prominently diagnosed in infants and young children. This is because a cough is common in other conditions such as the flu. Coughing typically begins at the incubation period of 9 to 10 days. Symptoms are comparable to the common cold. Some symptoms include running nose, nasal congestion, red and watery eyes, and a fever in some cases. After the 9 to 10 day period, symptoms become more severe, resulting in an aggressive cough and vomiting. One of the major indication and signs of pertussis is a wheezing or whooping sound while the human is coughing. Pertussis had high mortality rates and was considered deadly before the introduction of its vaccination in the 1940s. There were 250,000 cases reported in 1934 and only 1,010 cases reported in 1976. In 1980, however, 11,647 cases were reported. This acts as a major indication that the epidemic of pertussis peaks every 2 to 5 years. 90% of reported cases before the vaccination were children younger than 10 years of age. Currently, 50% of reported cases are adolescents or adults. This emphasizes the importance of adults to receive another vaccination later in life, as the pertussis vaccination is thought to wane over time. Symptoms of pertussis will worsen over time. It is important for doctors to properly diagnose pertussis. Diagnosis requires testing in the clinics and the lab. There are 4 methods of lab testing: polymerase chain reaction, or known as PCR, direct fluorescent antibody, or also known as DFA, serologic testing, and culture testing. PCR is the preferred method because it has a turnaround rate and is highly sensitive. DFA is rapid but requires specialized equipment that is not always accessible for healthcare providers. Serologic testing is less reliable in patients who have previously had the vaccination. And lastly, culture test is the most effective during the first 2 weeks. And sometimes people don't even know they have the condition until the symptoms worsen. There are 3 stages that occur during pertussis. The first stage is catarrhal. This stage includes upper respiratory systems. Some of these symptoms can include running nose, sneezing, and a mild cough. Stage 2 is the proximal stage. The stage includes a spasmodic cough and can last up to 10 weeks. Some other symptoms during the stage are cyanosis, which is the discoloration of the skin, and can also have a low-grade fever associated with it. Stage 3 is the convalescent. This is a stage where the cough gradually improves. This typically happens 2 to 3 weeks after the bacterium is transmitted. There are two vaccinations in order to reduce the chances of developing pertussis. The first one is diphtheria, tetanus, acellular pertussis, or also known as a DTaP. Tetanus, diphtheria, acellular pertussis, or also known as a DTaP, is another method. DTaP is used for children 7 years or younger, where the TTaP is used for adolescents and adults. There have been many studies conducted that suggest the importance of adults 19 years or older to receive a single dose of the TTaP regardless of previous treatment. This is because, as previously discussed, the vaccination of pertussis wanes over time. In terms of treatment, antibiotics are used to treat patients diagnosed with pertussis. The most common antibiotic used is the microlide antibiotic because they are thought to be the most effective for people with this condition. There are many short and long-term effects associated with pertussis. A long-term effect may include brain damage brought on by a seizure that can occur during uncontrollable coughing fits. A seizure can potentially lead to brain damage. Brain damage can hinder the person's ability to function. This may take away their ability to walk, talk, or eat. A short-term effect may include hospitalization due to untreated pertussis condition. An untreated pertussis condition may be due to a multitude of things. One of the most common is the fact that parents may believe that vaccinations go against their religion or lessen their child's immunity. Pertussis can have both long-term and short-term effects, not only on the person, but as well as their significant other. For example, hospital stays can affect the patient in many ways, such as weakness and depression. Hospital stays can affect the significant other as they may need to take time off of work. Some long-term effects can influence both parties as it requires 24/7 care, leaving no time for self-care or socialization. As a future child life specialist, is it important to understand various treatments of conditions such as pertussis? It is my job to make treatments and their recovery easier for both the patient and their significant others by talking about each process that will take place step by step in a way that will make sense to them. Aside from my role as a child life specialist, as a family study major, it is also important to understand how illness can affect the family dynamic. Attention will shift to one person, which can divert the focus on other family member issues, which may leave them feeling isolated. Lastly, as a child life specialist, it is important to have a basic understanding of symptoms of conditions like pertussis. This way, I am able to direct them to the help they need. Thank you for taking the time to listen to the conditions of pertussis.